Hello, I am Dr. Shane Fishbein. I'd like you to listen carefully for the next few minutes. I think what I have to say will be of great benefit to you. At the conclusion of this video, we're going to discuss with you the specific results of your examination and make our recommendations to you. But before we do, we'd like to discuss with you for just a minute our feelings about the doctor-patient relationship. You know, it seems as though most doctors these days are more interested in charts and tests than they are in their patients. Now, we feel charts and tests are very important as well, but we think it's time doctors start talking to the patient and listening to the patient. I mean, really listening. Too many doctors treat their patients like a number. They don't seem to want to communicate. They don't want to take the time to care, really care about their patients. Years ago, doctors were busy, but they were interested in their patients as people. They didn't look down at them. I think it's time doctors return to really being interested in their patients, like they used to be years ago. All doctors are busy, and sometimes doctors get behind, and are rushed and don't spend enough time with their patients. But we want you to know we care, and if you have any questions about your health, we want you to ask us. If we seem rushed, grab us by the arm and say, "Hey doc, I have something I need to discuss with you." I really mean it. I assure you we'll take the time to answer your questions and take care of your problem. Too many doctors think they do it all, and that's absolutely not true. It takes both the patient and the doctor working as a team to get results. If the doctor doesn't do their job, of course you won't get well. However, if the patient doesn't do their job, such as keeping scheduled appointments, following instructions, and not discontinuing treatments prematurely, you won't get the desired results either. It's a team effort. The patient and the doctor must work together as a team. You know, some patients discontinue their care prematurely. Some people think as soon as they are out of pain, they don't need to be adjusted anymore, so they quit. Then in a short time, they have the same problem again. Somewhere along the line, you're going to have to get your problem corrected, not just patched up. The longer you put it off, the more time it's going to take to get you well, and the more damage you will have done, and the more it will cost. I want you to understand about pain. Pain will stop as soon as the vertebrae is moved off the nerve. However, the spinal condition may only partially be corrected. Say 20% is corrected. If you discontinue care at that point, the vertebrae will heal where it is sitting, still 80% out of place. Each adjustment you get only moves the vertebrae a small amount towards being back in place. It is like driving a wedge in a tree with a hammer. It's just a little movement each time it's tapped. We want to know immediately when you're out of pain. But what we want more than that is we want your spine corrected as well as possible. You know, if you are only interested in relieving the pain temporarily, then maybe aspirin is a better answer. Obviously, it is much cheaper, but it won't work forever, and it does nothing about the cause of the pain. It only covers up the symptoms. Aspirin is the cheapest pain reliever there is. However, the fact that about 25 tons a day are sold in this country ought to tell you something. It doesn't get the job done. The pain returns. You will notice they are always careful to say temporary relief on those commercials, but it won't work forever, and it does absolutely nothing about correcting the cause of the pain. The cause must be corrected, and to be quite honest, correction is our professional goal and one in which we take great pride. We want more than just relief for our patients. We want to correct the problem to the best of our ability. If you have any doubts or questions at any time about continuing care after you are out of pain, or any questions at any time, please discuss them with us. We'll be happy to talk with you about it. This is where it takes both the patient and the doctor communicating with each other. I want your understanding on this point. I don't want to jeopardize the whole job we set out to do by giving you only temporary relief. I hope I can count on you to allow us the time it takes to complete correction, not just get you out of pain temporarily. We feel it's about time doctors really care about their patients. We've treated many cases of headaches, migraines, sciatica, bursitis, arthritis, asthma, and so forth over the years, but the patients who have followed our care recommendations exactly and didn't discontinue care as soon as they were out of pain are the happiest people today. Every day I hear patients say, "Dr. Shane, one of the best things that you ever did for me was to get me to follow through with a care plan. I haven't had any problems since I followed your advice. If I had my wish, every one of our patients would be in that category. I also want to teach you how to improve your general health. I am constantly reminded of the old proverb, which is better, to give a man a fish and let him eat for one day, or to teach him how to fish so that he can eat throughout his life. I want to teach you how to take care of your back and your health. In a few moments, we'll be giving you your personal report of findings. We will be presenting our best judgment of what is needed. If you are accepted for care, we will see you on a schedule that involves only the care that you need, when you need it. We insist, however, that strict adherence to your care schedule is followed. Therefore, we don't want you to miss any appointments. Your visits are scheduled for an exact purpose. We are committed to helping you get well.